We are excited to kick off our 2021 webinar series from the National Child Care Association. Welcome, everyone. Typically, right now, we like to get started and roll right at 1 o'clock. We have a number of registrants that are not in yet, so I ask that everyone just be patient just for a couple more minutes. We'll go ahead and kick this off. Just give everyone a little bit of time to get through here, but thank you all for being prompt and on time, and we'll get this kicked off here momentarily.
Hello, Maria. Thank you for joining us today.
Thank you to you.
Maria, are you an owner of a child care center or do you work?
It's home care.
Home care, okay. And how do you hear about us?
Email.
Okay. So you are receiving our emails?
Yes.
Okay. So how's the home care business going right now with COVID?
It's good. It's good. All child are coming.
Oh, that's good. So where are you located? What state?
Key West, Florida.
Oh, I live in Florida too. I live in Daytona Beach though.
Oh.
I love Key West. It's beautiful.
Yes. It's a small town.
Yes. How many children do you care for?
6.
6. So are you personally looking for a healthcare program?
I like to learn about.
Okay. Do you, now with 6 children, you probably don't have any kind of helper, right? Or do you?
No, only me.
How long have you been doing this?
15 years.
Long time. I was explaining we're having a lot of issues with people struggling to staff childcare centers. And at lunch, it's trying to get everybody, you know, out of the building. Have you ever worked in a childcare center?
No.
It's trying to get everybody out for a lunch break is really tough.
Okay, well, I'm going to go ahead and kick this off. Again, thank you all very much for coming to the National Child Care Association's first webinar of 2021. We know that your time is invaluable and we appreciate you spending an hour with us to learn more about telehealth. We're very blessed to have Vanessa with us today. Cindy will introduce you to her. I am Diane Michael. I'm the outreach coordinator for the National Child Care Association. And I'm just going to go over some housekeeping tips. I'm going to ask that everyone stay on mute unless you are asking questions or talking. We want to keep this very casual. We have a limited amount of people, but it's always about quality, not quantity. And if you want to ask a question during Vanessa's presentation, I just ask that, if you can't wait till the end, you just want to get it out, to go ahead and ask me, send your question to me. And that you simply do that by hitting the chat button. And then I'm Diane Michael with the NCCA logo. So again, if you have a question that you're just dying to get out during the presentation, just hit the chat button and shoot it over to me and I'll get it to Vanessa. But at the same time, you can also hold your questions until the end. And then this is just a disclaimer: by being involved in this platform, you are authorizing permission for this to be videotaped and uploaded to our website. Additionally, we ask that no reproduction or use of this video may be made without prior written consent by the National Child Care Association. And without further ado, I would like to introduce you to the director of NCCA, Cindy Lenhoff.
Good afternoon. Thank you for joining us. I am excited to have Vanessa with us today. I first met her at the FLACI conference in Orlando in the fall of 2019. And It took us a little while, but we were able to come up with a way to benefit our NCCA membership with affordable telehealth care. And I'm not going to take away from anything Vanessa has to say because she's the expert, obviously. But I do want to say that at this point in time with COVID, telehealth has definitely become more of the norm than it was when I first met Vanessa in 2019. And I think it could certainly help childcare providers and their staff get quick, easy, affordable healthcare to help improve attendance and also just how employees feel when they're at work, which we all know is incredibly important when they're working, with young children. You don't want to be at work with anything that you can spread or anything that makes you feel like you're not able to perform at your highest level. I do like to, at the beginning of each one of these calls, just do a little update on things that are happening out there. And I will make this brief, but just know to watch your email because Diane will be forwarding an NCCA email next week with a lot of information about the new stimulus money that is going to be made available to help childcare, both family childcare and center childcare during the COVID crisis, where we know that childcare centers have been affected financially and are struggling to pay rent and some of their expenses due to reduced attendance. And we're trying to keep them open and available to those essential employees that need us and keep our people engaged and working because they are essential now and forever. And we don't want to lose them when the attendance is down and, cut their hours. They need to be in the classroom and working with however many children, are here and enrolled. The good news is some of you may remember that back in March, there was a stimulus package passed and it provided 3.5 billion federal dollars to the Child Care Block Grant for states to utilize to help people that were receiving subsidy remain enrolled, whether they were working or not, to actually provide federal funds to pay for the care of essential employees who would typically not qualify. There were different states did it in different payments to providers. Some were from grants that you had to apply for. Some states offered money to their childcare providers to provide additional salaries to staff who were willing to work during the COVID virus. Pretty much what happens here is the federal government puts out dollars and the states decide how to best help their individual childcare providers. But there are rules around it. And I'm not going to go through all the rules, but basically it's going to be very similar to the last payout in your state. So if you received money to help you through, it's going to be very similar, only this time there's $10 billion that the federal government has put into additional child care block grant funds to help child care providers and families needing child care. So that's really good news. There were several organizations that we partnered with that lobbied and advocated very heavily, for $50 billion. And while we didn't get that, I think it's incredible that we received $10 billion when there are so many needs out there. So I do want to mention that First Focus, the Children's Budget Coalition, is a front runner in that advocacy. Child Care Aware of America is also a front runner and a partner to us. National Women's Law Center, Child Care Early Learning Coalition, and NACI. So I want to be sure that you know that we partner with all of those groups, and we also partner with all of you. and you have to help us make those calls. If you want to know more about this, it will show up on our website later this week or the first part of next week. You can go to our brand new, beautiful website. Thank you, Diane, nationalchildcare.org, and get more details so that you can maybe start calling your governor and your child care licensing department to see how you're going to be supported when this money is funded. It could take up to 60 days. So keep in mind that your state hasn't actually received the money yet. And ultimately, I would also like for you to remember to comment on our social medias sites that you may be seeing on Facebook, LinkedIn, Instagram. Give us a like or a comment, because that spreads the word about what National Child Care Association is doing to help support all of you out there. So I'm going to turn this over to Vanessa and give Vanessa the rest of the time available.
Thank you so much, Cindy. Thank you for giving VMD the opportunity today to speak to your group. I am the CEO and co-founder of VMD Healthcare Solutions, and today I wanted to talk about how telehealth can help both you and your employees, in regards to healthcare access. So today we're going to talk about VMD, introduction to telehealth, the new mental health pandemic that we've been under now thanks to COVID-19, how mental health affects employers as well as employees. We have a special for NCCA members as well, and questions on how do I enroll and what to expect, if you were to purchase one of our healthcare plans. So about VMD Healthcare Solutions, VMD's mission was to find an affordable and easy alternative to traditional healthcare insurance. What we did find amongst me and my partner is that there are a lot of employers out there who do want to be able to offer some sort of health insurance. However, either they can't afford it, or sometimes their employees can't even afford their portion. An individual could easily have a healthcare expense of $250 a month. Sometimes if they have a family, it could be $1,200 a month, just their portion. So the majority of families cannot afford that in today's economy. So we did want to find something as an alternative to be able to get some sort of healthcare access, when you did need to speak to a doctor or even get something such as dental care and so forth. So what we were able to do is be able to form a partnership with a telehealth medicine, as well as some other partners such as Aetna to provide dental care, vision centers such as Costco, Lens Crafters and VisionWorks, to be able to offer a more complete package for both you and your employees in regards to having something affordable for their healthcare. We also, again, our priority is also to bring healthcare to underserved communities. There are a lot of families out there that even, if they were to go to a government-sponsored clinic, sometimes they can't even afford the $5 copay. So what VMD does is that we allocate a certain percentage of our sales, and every year we donate plans to the underserved community so that they can have some sort of access to healthcare for themselves and their families. So we basically put the power of healthcare in your hands. All our benefits are accessible either via regular phone, website, or via the phone app. So you get care, immediate assistance right away. And what is telemedicine? Telemedicine has actually been around for over 20 years. And due to the COVID-19 pandemic, it has become, something that the mainstream media has made everyone aware of, during these times where they did not feel comfortable going to see a doctor. So if you do have any type of healthcare access at this moment, you might have had to, you're forced to make a telemedicine call with your doctor. And some of the benefits of that are, if you live in a rural area and you can't reach a doctor's office, or maybe it takes, 2 to 3 hours to see someone, telemedicine actually gives you access to see somebody right away. If you have limited movement, if you lack transportation to go see a doctor, telemedicine can help you. If you need some sort of healthcare while you're traveling, Let's say you get a sinus infection while you're traveling, or you get, strep throat, pink eye, anything like that, and you do need to see a doctor to get an antibiotic, you can use telemedicine for those type of occasions. It helps you avoid, the out-of-pocket expense of seeing a doctor in person. It helps you save time. Sometimes, you have to take a whole day out of work just to go see a doctor, and sometimes sit there for 2 to 3 hours, before they see you. And sometimes they see you for just 10 to 15 minutes. And all you really need is maybe a prescription. So telemedicine helps you avoid, all that, and helps you save time by conducting a visit virtually that maybe will take you about 5 minutes. If you need a prescription refill, telemedicine can help you with something like that. If you need to speak to a doctor after hours, let's say you wake up one day at 3 a.m. With a stomach bug, you could actually call and speak to a doctor at any time from anywhere. And again, they're open 24/7. The only thing that telemedicine will not help you with are emergency type situations, such as if you're experiencing a heart attack or stroke. So these are some of the basic conditions that telemedicine can help you with, not only medical, but also behavioral health. There is something now called teletherapy, where you can speak to a therapist, either a psychologist or psychiatrist, over the phone. We all know that nowadays we're all very busy, and sometimes, it doesn't fit into our schedule to take the time out to go, drive to see a therapist and, spend 2 to 3 hours, for a whole session. You can now do that via telehealth as well. You could also take care of certain dermatology issues, such as psoriasis, acne, insect bites, or any type of rash. So with today's pandemic, we like to say VMD was made for social distancing. Again, everyone is kind of worried as far as wanting to go see a doctor in person and sit in a waiting room, where they are, could be associated, and they could contact, either COVID-19 or some other, germs out there in the waiting room. So VMD helps avoid that. Again, because telemedicine has become kind of mainstream now due to the pandemic. Here are some of the benefits, as you can see on the left-hand side, where usually a visit to the doctor might cost you like $150 out-of-pocket expense. The average fee for a telehealth visit is $50. So you can see how cost effective it is in that sense. As far as, the workforce, it helps reduce absenteeism. So a lot of your employees will have to, they could actually avoid not calling out of work sick, just because they could just go ahead and speak to a doctor and get, what it is that they need taken care of, from their home, and still make it to work that day. It's also a better patient experience. As you can see here, the average wait time when you go to an ER could be 4 hours plus. An urgent care, you're usually waiting 30 minutes, or even a primary care physician, the average that you wait while you're there is 20 minutes. So the telehealth could actually give you access to a doctor within 6 minutes. So it really helps you as far as saving time in this busy world. So what VMD did was we partnered with Teladoc, which is actually the nation's largest provider as far as telehealth. We're a firm believer that, to be the best, you have to partner with the best. And what we did like about telehealth is, Teladoc, is that they have the most physicians nationwide. So what that means is that whether you're traveling, you're going to be able to speak to a doctor, from anywhere, and you're also going to get the fastest response time as far as a doctor calling you back. The average time for a doctor to call you back, they say, is within 10 minutes. But honestly, in my experience, the minute I put a request in, someone's calling me back within a minute or two. Teladoc also hires physicians with an average of 15 to 20 years of experience. There are a lot of telehealth companies popping up now, trying to ride this wave. And what we have found is that a lot of these telehealth companies, they don't just hire physicians, they'll also hire nurse practitioners. They're not experienced, and at the same time, because they do not have the high amounts of physicians on their network, sometimes they'll even have a service call you first, kind of screen you as to what it is that you need, and then the doctor will call you within 24 hours. So you're not really getting that immediate service that you would like with a company such as Teladoc. As far as the teletherapy, Teladoc has both psychiatrists and psychologists who you can schedule a call with. And if you do, like that therapist and you want to continue speaking to the same therapist, you can also, schedule that, over and over with that particular therapist instead of, just hoping to see if you get that therapist every time you call. So that's another advantage of Teladoc themselves. They're, of course, HIPAA compliant and secure. All their phone calls are private. And you could also store your medical records, which allows you to, later on share that with your actual physician in the office. And they also go ahead, and if you have, once you set up your account, if you have put a primary doctor's physician number on there and, contact information, whenever you do a Teladoc call, they're going to go ahead and send the information from that call to your primary doctor. So sometimes what we've been able to find is that, sometimes it'll take you 2 to 3 weeks to get an in-office appointment with a doctor. But once this doctor gets that information the next morning that you called in, the previous night for something that was somewhat of an emergency, sometimes that doctor's office will call you and get you in sooner than, having to wait 2 to 3 weeks of that average time to go and see them physically. So a question that most people have is, how does a virtual visit work? I don't understand how is it that a doctor is going to be able to help me over the phone. So this is a video that I wanted to play for you so you get an example of what a virtual healthcare call looks like. So as you can see, it's very easy to, have an opportunity to speak to a physician and, get a prescription if needed. It's also extremely easy to speak to a therapist at any time. We all have been under a lot of stress during this pandemic, and there has been now what's called, quote unquote, a mental health pandemic, just because of the anxiety and the stress that we've all been under. So these are some of the symptoms of what a pandemic can cause. And as you can see, difficulty sleep, you're concentrating, it could cause worsening of chronic health conditions, worsening of mental health conditions. There have been studies where have shown that suicide rates, as well as depression, have just multiplied, during this past year. There's been increased use of tobacco and alcohol and other substances. And of course, just because we're all worried about, our own health as well as our family and loved ones. So this is a study that Teladoc did in regards to the pandemic and how it has affected us mentally. They did report 47% have reported mental health issues, in the past year, although I really think that number is should be 100%. Sometimes we all say, oh yeah, we're fine, everything's fine, but we all know that deep down inside, not everything is fine. So I don't think there's one person, at least that I know, that has not been affected mentally due to this pandemic. As you can see here, a lot of young employees have been significantly impacted, as well as mostly women. Yeah, as you can see here, it says 57% women versus men. I think if anything, that number might be because us as women, we actually are more of the caretaker in the household. So we always take on a lot more responsibilities. And of course, sometimes men, don't want to show sometimes their weaknesses, and sometimes they'll just report that, they're fine. So now compared to, a few years ago, back in 2019, it shows here that more people are open to virtual care versus, maybe two or 3 years ago. So it says here, Teladoc Health meets the demand for mental health needs. We've had an increase of 100% in mental health visits for ages 18 through 30, and an over 60% increase in members, stating that they have some sort of anxiety disorder. These are some statements that I pulled from a recent article that showed, the effect that the pandemic has caused, particularly amongst teachers as far as mentally. And the title here is Amid Coronavirus Pandemic, Teachers' Mental Health Suffers in Ways They've Never Experienced. So I thought this was very interesting and, kind of impactful, and a surprise that 28% of educators said the pandemic made them more likely to leave teaching. It really saddens me just to see that, just because, there are less and less people wanting to get into that role. They're underpaid. They're not appreciated. So, if we already have a shortage of teachers, now this mental pandemic might even cause the ones that we currently have not to get out of the field. So I think they definitely need some sort of help. It says rates of depression almost doubled, with more than a third of those educators indicating depressive symptoms. Only a quarter said that their school offered adequate support for mental health. There are access issues to mental health services, some reported. Most of them would say, I wish I could say I'm handling it so well and I'm on it every day, but she said I'm not. Going back to what I said is, we always like to make it seem that everything was okay. So sometimes we have a hard time admitting to ourselves or to others that, we might need some sort of help. It shows that research has shown that teachers' mental health declines when their students are doing poorly. So that's just another sign that these teachers do need help as far as their mental health is concerned. If the responsibility is in their hands, as when it comes to educating our children and taking care of them. It says, for the first time in my life, I have to see a therapist. That was a quote from one of the teachers, from a professor at UCLA. It also says, but therapists covered by teachers' insurance plans may not have evening hours, and they don't necessarily have the time or spare money for weekly appointments. So that in particular is important because, again, telehealth can give them access, to a therapist at any time. And through VMD, we actually made that affordable. So again, this is a slide in regards to Teladoc and their telehealth therapy visits. You could choose a therapist or psychiatrist who fits your needs. Once you log into the account, it's going to ask you a series of questions so they could better pair you with the right therapist, in regards to your current situation. You could schedule an appointment 7 days a week, and those appointments are held between 7 a.m. to 9 p.m. I actually know of a lot of people who have started to take some of their therapy sessions, in their car, in their driveway, sometimes just to be able to get a break from, everything that's going on in the household. These are some quotes from some Teladoc members and how they have used Teladoc and how that has helped them in regards to their mental health. It says here, I've only been in sessions for a couple of weeks, yet I've noticed major changes in the way I live life. So what does mental health therapy help you with? Mental health is not about erasing problems and stress. It's about building the skills, strength, and character to be able to handle problems and continue towards your goals. So again, I mean, one session is not going to wipe away your problems. Again, the advantage of Teladoc is that you can continuously keep seeing a therapist, and this therapist is just going to be able to give you the tools as to, how to handle life and some of the problems that you might be facing. Now, in regards to employers, what some employers are not aware is that their employees' mental health can actually really affect, their productivity at work. It could affect their absenteeism. Sometimes an employee might start calling out of work sick because, they're depressed or they're just anxious and they don't know, how to handle life at the moment. And the last thing they want to do is go to work. Sometimes, these mental health issues can cause problems amongst, other employees. It could cause them to not be able to focus at work. And, again, the productivity rate can go down for that employer. There's a statement here from Forbes magazine that says promoting good mental health in the workplace could be one of the most important steps an employer could take to improve an organization. I'm a firm believer that, if you don't take care of your employees, they won't take care of you. So I think it's very important as an employer to show your employees that you do care and be able to implement something that's going to give them access to the right healthcare at the right time. So what we did to help employers, that are NCCA members is that we did create a body and mind package. And what this package includes is unlimited Teladoc virtual medical visits, as well as teletherapy. We have an unlimited telephonic employee assistance program, which is something that, if an employee just needs to speak to somebody, at any time, just because they couldn't speak to somebody at that moment, they could call this employee assistance program and speak to, a counselor right away. But it's more for short-term counseling, while the Teladoc virtual mental therapy is more for long-term. We also wanted to create something that, would be a complete package for everything outside of basic healthcare medical visits. And that's access to the Aetna Dental Network. We have access to vision centers such as Costco, Target Optical, Lens Crafters, and VisionWorks, where you would receive an additional discount as a VMD member. We also have a chiropractic care discount program, and then we also have savings in regards to any prescription drugs, lab testing, vitamins and supplements, and even medical equipment or MRIs and CT scans at imaging centers. The great thing about our plan is that it actually covers the employee's entire family. It covers one additional adult and any dependents up to the age of 26. We don't require a contract. The Teladoc visits are completely free. You do not have to pay a copay or any type of fee every time you use the service. If anyone is familiar with Teladoc, you could even go to their website and you'll see that just one medical visit is $70 just for one time. So as you can see, we do have significant savings as a VMD member, and there are no other hidden fees. So if you think about this, for $25 per employee per month, this is only going to cost you $300 per employee per year, which is also tax deductible. And it's going to help you, retain those employees. It's going to help you attract new employees because you might be offering something that, the center next door might not be offering. And it's also going to make your employees a lot happier. And it's going to just make it a more healthy workplace, at your facility. So again, our telephonic employee assistance program was founded in 2001 by former Aetna U.S. healthcare senior executives. So this is a company that has been around a very long time. So they do have very well qualified counselors to help at any time. It's available 24/7. And again, even your members in your household can use this service. It's not just for the employee themselves. As part of the package, again, we have the Aetna Dental Access network discount program. We have over 240,000 available dental practice locations. If you need, let's say, cleaning, if you need a cavity filled, you're going to save anywhere between 20 to 50% per visit. And it also includes anything such as, orthodontics and periodontics. You could also use our VMD app to locate some of these providers in your area. And the biggest advantage of the VMD app is that it will also give you the pricing right away. So we do kind of like the price comparison shopping for you. So if you need a cleaning, you know, it might say that one dentist charges $60. It might say that the other dentist next door to him charges $80. So the VMD app also helps you save time besides money in regards to shopping for a dentist. As far as the vision discount program, you know, again, we have partners such as Costco, LensCrafters, ProVision. It's going to help you save 20 to 60% off any prescription eyewear. And even in regards to LASIK surgery, there are savings there anywhere between 40 to 50%. You could also locate providers in your area via our VMD app. Our chiropractic care discount program helps you save anywhere between 30 to 50% on x-rays and you know, any other type of treatments that you might need. It helps you get a free initial consultation, and you could also find providers via the app as well. Our retail and discount mail order pharmacy benefits helps you save at over 60,000 retail pharmacies. You could also even do a mail order for any, you know, regular prescriptions that you might need. And you could also compare pricing from all your pharmacies in your area via our app as well. So Direct Labs is one of our labs partners. What I love about, you know, using this service is that you do not need to get a prescription from your doctor to get access to lab testing. Sometimes we want to be able to check, you know, let's say our hormone levels or maybe our vitamin D levels, but we want to skip the cost and time of going to see a physician and getting that lab work, you know, that lab order. Direct Labs actually, you know, gives you access directly to order this lab testing, and the lab testing is also done by, you know, the major labs in the area such as Quest Diagnostics and LabCorp. So VMD is constantly adding new partners, you know, to our app. So with our app, you could have savings at places such as VitaCost for some of your vitamins and supplements. If you need any type of medical equipment or diabetic supplies, even if you need to get, you know, an MRI or some sort of CT scan, you know, our partners would offer you an additional discount. And also in regards to our radiology centers, some of these centers don't require a script either from your physician. So once again, that's going to help you save time from going to see a doctor and the money that, you know, that doctor's visit would cost just to get a script for getting some sort of imaging done. We also just recently partnered with a CBD company called Dwell, which has very good high quality CBD products, and we are able to extend an additional 20% off their products. So if you're an employer, you're probably asking, okay, so how do I enroll my employees in this plan? So, and what is it do I need? Is there a minimum number of employees that I need to enroll, you know, to be able to save and get this discounted benefit through NCCA? And the answer is that we only need 3 employees. 3 employees and only 3 forms are needed. All we need is a basic listable agreement, which lists the basic, you know, basic information about your company. An ACH form where we will you know, deduct from your bank account the membership every single month, and a member enrollment census file, which is just basic information of your employees, such as, you know, full name, date of birth, address, phone number, and email. That's all we need. We're aware that maybe sometimes some employers do not offer benefits, and we have individuals who would like to purchase some plan. Purchase one of our healthcare plans. So we are offering a 20% discount to the individual plans on our website. So in regards to the current plan that we are offering NCCA for $25, if you're an individual and you're looking to get some sort of healthcare coverage, we're able to offer this plan to you at a discount of $40 versus a regular $50. And again, this is going to cover your entire household, not just yourself. Once you're enrolled with VMD, we will send you a membership kit, which includes a membership card, as well as a membership booklet detailing all the different benefits and any important phone numbers that you might need. If you need any type of member support, let's say you want to add a dependent, or you want to find a local dentist, if you're just having difficulty with our app, although our app is very user-friendly, we do have a US-based member support team that you could call, anytime between 7 a.m. and 7 p.m. Central Standard Time. We also have a client portal for any employer groups where you could add and remove any members as you need to. And again, you're probably wondering, okay, how do you deliver all these benefits in one place? And that's through our VMD app. So I'd like to give you a demo as to what our app looks like. So some of the most frequently asked questions that we get is this covered by the Affordable Care Act? And the answer is no. This is not considered insurance coverage. This is just considered access to healthcare. Is there a contract? We do not require a contract. You could cancel at any time with a 30 days notice. When do I get billed? We automatically will deduct your bank account usually around the 20th of the following month. Now, what if an employee is terminated or leaves mid-month? So what we do is that we take a snapshot of all employees taken at the last day of the month. Therefore, if you do need to remove an employee, if you remove them before the end of the month, you won't be billed for that employee. Does the membership also cover my family? Yes, our plans cover 2 adults and dependents up to the age of 26. Is the program available in Spanish? The question is yes. Membership kits are available in Spanish upon request, and the app can be switched to Spanish under settings. Once again, when can my employees call if they have any questions? And again, we have that member support team available Monday to Friday and also on Saturdays. Now, for those who made it to the webinar, thank you once again for making the time to be here. And for that, we do offer a special. If you sign up within the next 30 days, you and your group will receive free KN95 masks for you and your staff. We are really trying to push everybody to stay healthy this year. So that's one of the things that we are able to provide. We also have a dedicated PPE website, which we established for our current clients who are desperately looking, for PPE equipment and supplies when this whole pandemic started. And that's vmdppe.com. So I just wanted to play this quick video, just because, again, I think going back to the stress and the anxiety that this pandemic has caused and how VMD can help. So as you can see, VMD can help alleviate any of those stresses or those moments where you're starting to feel just a little sick and you're wondering like, oh, do I have COVID now? VMD helps you have basically a doctor in your pocket that you could call at any time. If you'd like to follow us, we are consistently posting, healthcare tips and different news in regards to new partnerships and new services that we now have available. So you can find us on Instagram, Facebook, Pinterest, and as well as LinkedIn. And if any of you would like to contact me directly, you could email me at any time at vanessa@vmd.com. So with that said, does
thank you,
anyone have
Vanessa.
any questions?
Well, I think Vanessa, you there were such good explanations that I don't know that we'll have very many questions today. But I would just say that that last screen really made me smile. I'm a dog lover, and
Me too.
and I was picturing my own dog, my own pug with a mask on. He may have to get a picture taken with one now that I've seen that one. Certainly, I will be sharing this not only with those that participated today, but it can be viewed on our brand new website at nationalchildcare.org. And we also will continue to advertise this wonderful benefit on our periodically on our social media websites. So thank you again. I hope those of you listening are taking care of yourself, because if you're not taking care of yourself, can't take care of others.
Well said.
And you all are very responsible for taking care of so many. Most of the people that work in this industry, as I explained to Vanessa earlier, and I'm speaking to the choir here, they're not only the caregivers at work, they're the caregivers at home. And not only do they have their own children, but sometimes they have parents they're caring for, or spouses, because some spouses can be a little needy at times.
Yes.
And just between you
Very
and
true.
call. So I know everybody's busy, and those of you that work in the field, I'm sure nap time is almost over, and which means back to work with children that are awake. And again, this is Cindy Lenhoff coming to you from the National Child Care Association, and I hope that if any of you feel the need to just talk to someone that has walked a mile in your shoes, you can also contact me through our email address on our website, which is again nationalchildcare.org. It has changed, so I want to make sure we get that out there. Have a good afternoon.
Thank you, everyone.
Thank you.
Stay safe.
Thank you, everyone.
Thank you.
Bye.
Bye.
Bye.